as part of the celebration of World Heart Day, I have a simple message to all the adult Indians about taking care of your heart. First of all, how you feel, how fit you feel has nothing to do with how fit your heart is. It is very, very important for every Indian adult past the age of 35-40, or the ones who want to exert themselves with extreme sports at a much earlier age, to undergo some basic tests. That's routine blood test, a ECG, echocardiogram, and a CT angiogram to find out whether you have any coronary artery anomalies or coronary artery blockages. Once these tests are okay, we can assure you that it's very, very, very unlikely you will ever have a cardiac event.
Cardiovascular diseases or CVDs are the leading cause of death globally, accounting for about 30% of all global deaths in a year. India has one of the highest burdens of CVDs worldwide, with 1 in 4 deaths caused by them in India. Advancements in diagnostics have made possible precise risk assessment of heart diseases with blood tests. Various risk factors for CVDs include dyslipidemia, commonly known as high cholesterol, and diabetes, hypertension, sedentary lifestyle, smoking, and other causes. Dyslipidemia is the most prominent risk factor in the Indian population, but this can easily be managed by regularly monitoring the lipid profile. Tests for diabetes are also crucial for prevention and management of heart diseases. Lipid Association of India recommends screening of all adults above the age of 20 years for cardiovascular diseases risk factors, especially the lipid profile. Preventive health tests should be done earlier if there is a family history of heart disease, dyslipidemia, obesity, or other risk factors. LDL cholesterol is considered as a target marker to see effect of treatment in an individual also. Lipid profile also forms the basis for several key therapeutic decisions, such as the need for and quantum of statin therapy. Individuals must consult their doctors if they have total cholesterol over 200, triglycerides over 150, LDL over 100, and non-HDL over 130. A lipid profile can now also be done without fasting, or what we call non-fasting lipid profile. Proponent test is another important test for risk stratification of apparently healthy individuals for future cardiovascular events. Troponin is normally not found in the blood, but when heart muscle becomes damaged in a heart attack, troponin is released into the blood. As the heart damage increases, greater amount of troponin are released in the blood. High levels of troponin in the blood may mean you are having or recently had a heart attack. High sensitivity troponin or HS troponin I above 6 nanograms per liter in males and 4 nanograms per liter in females is considered as a risk factor.
Heart disease is one of the common cause of death in India. It is so common that we all are very particular about screening our heart ailments very, very regularly. But when you do this screening, you need to follow 3-4 principles which I would like to suggest. Number of tests which you do and the type of test which you do has to be very wisely selected. There is no need to do all the tests together. It has to be very much appropriate to your age, sex, your clinical history and your family history. After you have selected right tests which are appropriate for you, you need to again follow 3 principles, which is screen, monitor, reflex. After screening whatever elements have come positive, probably you need to monitor them regularly, or you need to do reflexing. Reflexing means you have to go into next level of detail of the test. Having result is not enough. Taking action on the result is very, very important, and for which involving a physician is extremely important. Having known these principles, let's move to what tests are available in a lab. A lab typically does basic as well as specialized tests. The basic test which is required for heart is screening for your lipids. Cholesterol, triglyceride, which are commonly known, are the lipids. In case your cholesterol is abnormal, you may have to go into next level of test, which is knowing your good cholesterol and bad cholesterol level. Imagine your bad cholesterol is abnormal, you need to go again into the next level. You may do your tests like LDL subfraction, your VAP cholesterol or your NMR cholesterol and so on. At times some genetic marker like LPA you may do. And there are certain enzymes which are also very important for heart disease, which is like SGOT, your knowing your CPK and CKMB level also becomes an important thing. You know that cardiac disease are very much connected with kidney as well as diabetes, and hence screening your diabetes through blood sugar test and doing your kidney function test like creatinine is also becomes vital. There are some special coronary risk marker which predict risk of having a cardiac disease. These are called high sensitive troponin I, which is a very latest marker which has come up. There is something like high sensitive CRP and D-dimer which have been always used. Homocysteine becomes very important. There are some novel marker like FABP and many more which are yet getting established. These markers also can be kept in mind.
We know heart disease is a chronic condition which develops over a period of time. It starts with a minor injury to the blood vessels which supplies the blood to the heart, maybe due to a fatty deposit, and then it goes on increasing and it may lead to a total blood flow stop to the heart, which can cause complications like cardiac arrest or heart attacks or acute myocardial infarctions. Usually males are more prone to have heart attacks, but the way lifestyles are going on, more and more younger populations are also having heart health. So prevention is always better than cure. We have seen people of heart attack who may have chest pain, discomfort, or sometimes no issues, but they come to emergencies. Usually most of the clinicians ask for blood test as troponin test. So this is a very important marker which actually can help the doctor to understand, yes, this is a heart attack, so that immediate action can be taken based on this. But that's a little bit later stage. We actually should do monitoring of our heart diseases from a long early phase, or like say in a very younger generation, young population, or when we are almost like 30-32 years old. We are doing annual health checkups, there are preventive health checkups, and we should see whether the tests which can determine heart health are included in that. So most common tests are like lipid profile. Lipid profile identifies total cholesterols, HDL, LDL, triglycerides. Now this LDL, which is a low density lipoprotein, is also called as bad cholesterol. It actually makes little bit of fatty deposits into the vessels, and injury to these vessels, it can create complications. Similarly, HDL is also called as good cholesterol, which helps the heart blood vessels to pump the flow to be very smooth. Not only that, there are certain tests like high sensitivity troponin or high sensitivity CRP. So these markers usually come into the blood and their levels get elevated or increased even when there is a minor injury to the heart muscles. So they not only tell you the current situation but also a risk for future heart diseases. Then there are tests like lipoprotein A, which is a very specific cholesterol. In these cases, when it is on the higher side, the heart disease risk increases almost by 3 times. Then there is people with diabetes. They also have a very high risk of developing heart disease. So people with diabetes also should regularly monitor their HbA1c and show it to the clinicians to take appropriate measures.
Blood vitals would be able to diagnose heart diseases. In different age group, the heart disease have got different incidence, but as we grow older, usually in males more than 45 years and in females more than 55, so basically post-menopausal age group, the risk of heart disease is more. So that is the place where we maximally target for doing a health checkups to prevent any heart disease and find out if the heart problem is there or not. When you look at the good cholesterol, that is HDL, it has to be high, and the bad cholesterol has to be lowest. So if you decrease the bad cholesterol LDL by 1%, risk of heart disease goes down by 2%. And HDL also protects against heart disease, so we should try to keep HDL cholesterol level high. In troponin I is like similar some biomarkers which immediately diagnose high risk of acute coronary syndrome, and if the troponin I is high, we should take this patient as serious and they are having high risk acute coronary syndrome and should investigate further, like doing an echocardiography and abnormalities if it is high, then these are the patients who would need angiography and all. And as a layman, I think the preventive health check should be done for lipid profile, the troponins, the NT-proBNP, and all these tests will diagnose whether you have a significant heart disease or probability of heart disease. Now we have got access to genetic profiling also, by which we can find which individual is at a higher risk of cardiovascular disease. Thank you.
The age group which commonly undergoes preventive health checkups are usually people above 50. But nowadays the trend is changing and people even above 35 are undergoing health checkups, and commonly males tend to undergo more health checkups than females. The LDL is what we call the bad cholesterol and the HDL is the good cholesterol. This means the LDL actually deposits more fat into the artery walls while the HDL removes the fat out of the artery walls. So the ratio between the two is important, and lower the ratio between LDL and HDL, the better it is. So yes, this is one of the tests which is good to detect fat deposits in the artery walls. The troponin blood test is traditionally used as an acute marker for acute coronary syndromes. So anybody suspected of having an ongoing cardiac event like an ongoing myocardial infarction or commonly known as a heart attack is recommended to do a troponin test, or rather a high sensitive troponin test. So this high sensitive troponin test means that it can detect very low levels of troponin in the blood, and anything above 34 is considered to be a significant value. But what we have to understand is that because it is so sensitive, we have to repeat this test after 1 hour, and a rising trend then signifies something which needs to be looked at further. So just a HS troponin, a single value is not enough, but a rising trend is more important. Nowadays HS troponin is also recommended as a preventive cardiac marker in some of the recent data which is coming up. We need more data on this, but broadly what this tends to show is that higher the HS troponin value in an apparently healthy individual, higher is the risk of cardiac events and higher is the risk of future cardiac disease, not necessarily current. So anything above 12 in males and 10 in females is considered to be significant, and all it means is that you need to monitor your cardiac health more closely and consult your cardiologist about the same. No need to panic and undergo any more blood tests or anything, but just keep a close watch on your diet and lifestyle. Now, apart from HS troponin I and your cholesterol, we also have the HS-CRP, which signifies general inflammation in the body. Higher the HS-CRP, more is the inflammation in your body, but this is a very indirect marker of cardiac health. So, more specific to cardiac health, cardiac specific markers would be your HS troponin I, your cholesterol, which includes the total cholesterol.
There are ways to risk stratify you by simply using certain scores which look at the history of blood pressure, sugar, high cholesterol, family history of heart disease in your family, your lifestyle, like how much fruits and vegetables you take, how much walk you do, whether you're sedentary or an active person. And this can give us a score which tells us about whether you are at risk of, what is your 10-year risk of heart disease or stroke, like Framingham risk score or Q-risk 3 score, etc. But we do have certain tests, blood tests, which we can do. For example, extended lipid profile, where we're looking at LDL, HDL, triglyceride levels, the concept of what is known as non-HDL levels, which are part of the lipid profile. There is also a new, not so new, but a relatively more emphasized upon entity called lipoprotein little a or LPA, which is being done and has been shown to be a putative risk factors for coronary artery disease and stroke. Other than that, there are certain markers like NT-proBNP and Troponin tests which we do when we see somebody who has had chest pain or is suffering from significant breathlessness on exertion. And these two tests can pick up if somebody is having an ongoing heart attack, ischemia or heart failure like situation. So we do have certain blood tests which can pick up heart disease or acute heart attacks, etc. in our repertoire. Other than that, there are certain tests which we do in terms of imaging. For example, exercise stress echo or nuclear medicine test like exercise thallium, stress thallium test, or CT coronary angiography or CT calcium score. Now, CT coronary calcium score does not require any dye or injections and can give us how much calcium is deposited in our coronary arteries, which just takes 5 minutes to do. Coronary angiogram, on the other hand, chosen appropriately, can give us a pretty good idea about the blockages in the heart. The concept to understand is that it is not the amount of blockage or the degree of severity of blockage which is important, rather than it is the vulnerability of the plaques deposited which is more important, which is completely dependent on your risk factor profile.
World Heart Day, I'd like to talk about how 1 out of every 5 heart disease globally happens in India. 25% of all coronary artery diseases happen in people aged less than 40 years. And 50% of all heart attacks unfortunately happen in people who are less than 55 years of age. Also, post the pandemic, we've seen that because of a rampant sedentary lifestyle, there are more and more youngsters who have a cardiac disease. So how to prevent this and how to check this frequently? So firstly, all of us should know that anyone who's aged more than 20 years should be getting a cardiac check done once at least to see if everything's normal. And once you know it's normal, then you needn't repeat it for about 3 to 5 years. But then again, after 3 to 5 years, I suggest that you repeat these. Although a comprehensive cardiac check would include certain imaging tests and blood tests, but as a first-line preventive check, we suggest that you do a lipid profile. A lipid profile essentially has an LDL, HDL, triglycerides and various ratios that tell you about your cardiac risk. An LDL essentially is a poor cholesterol or the bad cholesterol, and an HDL is what is good for you, and it is called a good cholesterol. Apart from this, also you have certain parts such as homocysteine, apolipoprotein A, apolipoprotein B and lipoprotein A. This can also be included in your extended lipid profile. Also, you have certain other tests like high sensitivity troponin I and high sensitivity CRP that tell you more about your cardiac risk and if you need to be extra careful with respect to your lifestyle, your diet and other things. Apart from this, also you have various other tests such as proBNP, such as CPK-MB, etc. But these preventive heart tests such as lipid profile, high sensitivity CRP and high sensitivity troponin I give you a fair idea about where you stand and what is required in the years to come. Also, a little bit about troponin I. This is a protein that is released whenever there is any stress on the heart. So sometimes your doctors might ask you to get this done in case you've had any kind of chest pain or any kind of angina. But otherwise, it also works very well for you to understand your cardiac risk and take effective measures.